So when I'm not there, and probably there's nobody else employed, who remains there to serve people? Probably an unqualified person. That's what I mean by absenteeism. So on paper, the pharmacy is registered, it's licensed, but who is there physically present to serve? Someone who is not qualified. So I think that is why we are doing badly. The basics is about personnel being licensed and all that. But when you go to the details of practice, there are so many other issues which we are trying to handle. Yeah, anybody can search from anywhere in the world. If you want to search Ochieng, maybe my two names, you don't need to know. You can search by ID, by registration number, which is also usually displayed on the document. You can search, and if the pharmacy is registered or the personnel, you can also search. So one of the areas which this country has been called out on is the people who are selling antibiotics over the counter without prescriptions. People who are selling antibiotics to people who do not need them, and things like that. Yeah.
Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Hello and welcome back to another episode of the Daktari Tone podcast. With me, I'm still joined with Dr. Wilfred Ochieng, the Director of Pharmacy Practice at the Pharmacy and Poisons Board. For this segment, we're going to dwell onto what the state of pharmacy looks like now and what we expect in the future. So, Daktari, my first question to you is just with the same regard. From your vantage point today, how healthy? Let me use the term healthy. How healthy is the pharmacy practice in Kenya?
It depends on the metrics that you want us to use to determine health. Mm-hmm. At least, if you're asking about BP, we can say it is above 140/90, then it is hypertension. Mm-hmm. For pharmacy practice, I think the data that we use basically would be in terms of level of compliance. Yeah. Because if you go into the details of practice, then again, I cannot say that we can have very comprehensive data. But let me start with compliance. In terms of compliance, I think we have seen quite some improvements. I don't have figures, because I didn't come with any data. What I know is that because of the presence of PPB across 10 regions in this country, and because of the enforcement efforts, we are able to regularly inspect people who have been licensed, and we are also able to detect those who are operating without what we are calling quacks. I think that's a language people understand better. So I think our level of compliance is quite good, because if I look at the last time I checked the PPP data for 2025, we had over 8,000 registered retail facilities. I think close to 1,700 hospital facilities which had licenses, and that's quite huge because it's ranging from the lower levels are more. Of course, the higher levels, the highest level is 6, where we have the referral hospitals. Then we have the level 5s, which are also quite much fewer in the country. Then level 4 down to the 2, which is clinics. So for compliance, I think we have also been able to achieve a higher level because the numbers of the registered pharmacies who are also licensed has been going up. The number of these pharmaceutical technologists, those are the diploma holders, has also been growing very steadily. So we have providers, the workforce. So despite still being below the global average per 10,000 population, I can say Kenya is doing quite well, and we have seen quite some interest in terms of people who want to train more and more pharmacists. So I'm talking about 10 years ago as compared to now. I think now we have 9 universities that have been approved, and most of them are already graduating young pharmacists. Diploma colleges, KMTC has expanded a lot, and there are many other colleges also training. So workforce, we are doing quite well. People complying with licensing requirements, you have seen an improvement. I don't have figures to demonstrate that, but I'm sure if I went back to our database, we'll be able to.
Before we get into documentation.
So I'm just saying I'm sure that is the status. Yeah. Then,
quality.
In terms of quality, let me start again from training. We have seen quite a number of people pursuing specialized areas. Let's say in hospital pharmacy, I mentioned you have clinical pharmacy, then you'll have, let's say, people who have specialized in oncology. These are pharmacists whose area they are basically dealing with cancer medication or cancer treatment. You have people who are dealing with different aspects, and some of them have even been feted in this country for their contribution. Some hospitals now, pharmacists were traditionally considered to be people who sit in the pharmacy. When we in college, our medic colleagues used to call us shopkeepers. It was our whole internal joke. Shopkeepers, how are you? Because of the impression that pharmacy practice was about selling drugs.
Yes.
Yeah, but the attitude has changed. It's about offering of pharmaceutical services. When we say that, it's a more patient-oriented kind of practice.
Yeah. They're now including pharmacists at the level 4.
I'll speak to that in a moment.
Okay.
What I'm saying is that the practice has actually moved more to a patient-centered practice. So that's, we look at pharmacy not as a business as such, where anybody, even mwalimu, thinks that hii ndio biashara imebaki, anafungua. The customers, the population is becoming more aware. And of course, mixed with technology, they also have access to information. So, as a practitioner, you need to up your game. You need to offer something beyond what AI can provide. If I want to know what are the possible side effects of Viagra, you should be able to explain to me better than what I'm getting.
Dr. Google.
Yes, and give it a more human face. If, let's say in a hospital setup, and some hospitals have really perfected this, every day when they go for ward rounds, there has to be a pharmacist in the team. So the role of the pharmacist as a member of the overall healthcare team is also changing. So other professions recognize their contribution, and they have to be included when they are discussing matters like during ward rounds and all that, and designing the best treatment options for individual patients. Now you're asking me about level 4. Categorization of facilities in this country is based on the infrastructure that they must have, of course the human resources for health that they must have. And this is, the ministry did this quite a while back. That was in 2015, that's about 10 years ago, when the Ministry of Health came up with the norms and standards which define the level of a facility, what they are required to have at the minimum, and what they can do is also defined by that. It's also defined by the type of personnel that they need to have. So when you talk about level 4 and above, and all these other levels, then that is defined in a policy document by the ministry, which I think may still be subject to revision. But at the moment, I think the current version is 2015. And then, of course, under the Medical Practitioners and Dentists Act, which is Cap 253, they also have some regulations which were developed to determine what needs to be followed to classify facilities. So what is special about level 4 and above? Level 4 and above, you start seeing more specialization in terms of services. So at that level, you'd expect maybe, according to the norms, you have pharmacists who have specialized at least in clinical pharmacy. And that means beyond your bachelor's degree and being registered, you have undertaken further training, and usually it's at master's level, and of course gained experience to be recognized as a clinical pharmacist. Then there are other areas like oncology that I mentioned, and I won't mention all of them, but there are areas of specialization which have also been defined in the Pharmacy and Poisons Board guidelines on specialization. So that is it. So what you're hearing about level 4 and above is just that, you see, healthcare was devolved. We have both the public and the private sector. But good regulatory practices requires that you apply the same standards to private institutions as you apply to public. So you don't have standards for public and standards for private. So what we are saying is we want facilities to comply with these requirements. If the issue is about the numbers and the wage bill, which is an issue subject to debate in this country, then we're talking about progressive realization of those standards. You must have a way of progressively doing that here. That's what we're talking about.
Okay. Now, what are pharmacists doing well now, and where are they falling short?
Well, that's a tricky question because it's a blanket question. And
you can mention a few.
What I can say is that I think the attitude of pharmacists has really changed. Sometimes when you look at the number of people who are pursuing excellence, I think it's quite encouraging. Yeah. By the time we graduated with a bachelor's degree, very few people used to go back to study. And as I mentioned, again, specialization, very few people are specializing. So I think what pharmacists are doing better is that more are specializing to offer better services. More people are engaged in, I think every week there are a lot of opportunities to continue learning. You don't retain what you learned in school only, you keep learning. I think that is one area which I really consider very useful in terms of being ready to offer excellent services to patients or customers, whichever you call them. And in community pharmacy, I think people have realized that having a population that is aware, then you also have to up your game. So it's not about having a facility there and then you're just selling drugs. Now, again, when you asked me about what they are not doing right, I can say, there's a good and a bad side of everything. Yes. Where you have people trying to strive for excellence, you also have the people who are drawing back. So one of the problems, or where I can say we also have people doing badly, is something we call absenteeism. Yeah, what I mean is I could be engaged in a full-time job somewhere else, But according to the data that the Pharmacy and Poisons Board has, I'm supposed to be in charge of another pharmacy, which is kilometers away. And kilometers, I mean, could be in another town far away. So officially, if there is any problem with that facility, the person we are calling superintendent or in charge is taking the regulatory responsibility overall. Of course, every person who is employed there is supposed to be under the supervision of this superintendent. Yeah. And to give you an example, if let's say I have a pharmacy we are in Hurlingham area. So let's say you have a pharmacy in Machakos where I'm supposed to be there in charge, but I'm here engaged in PPB full time, what we are calling the 8 to 5, how many 9 to 5? So when I'm not there, there are supposed to be other qualified people who are working there. But this is not a good example. What I'm just saying, even if I was to be working there, the pharmacy is open, let's say, from 7 a.m. to midnight. You don't expect me to work there from 7 a.m. to midnight every day. It's humanly not possible. So there are times when I'll not be available. But I'm not available, or depending on the workload, there are other people who need to be employed who are qualified and duly licensed to take responsibility as a professional.
Actually, when talking about employment, I also have an understanding that there's also many pharmacists also are not employed at the moment. The number is...
Yeah, that is also there. Okay, I was to finish this absenteeism thing first, yeah? So when I'm not there, and probably there's nobody else employed, who remains there to serve people? Probably an unqualified person. That's what I mean by absenteeism. So on paper, the pharmacy is registered, it's licensed, but who is there physically present to serve? Someone who is not qualified. So I think that is where we are doing badly, and it's something where we are trying to partner with the professional bodies. Like now in pharmacy, we have the Pharmaceutical Society of Kenya, which is the umbrella body for pharmacists, and then pharmaceutical technologists have Kenya Pharmaceutical Association. Both organizations have branches across the country, and we feel that in terms of peer-to-peer review and being your brother's keeper, they can serve as an entry point for self-regulation. So we require everybody to be a member of at least a professional body and then participate actively. They are also approved as providers of continuing professional education or development. So that is one mechanism we are trying to use to mitigate that. Now, coming to the employment issue that you're talking about, then I keep telling people that this is about market forces. Because if I, as a pharmacist working for the government pays me this much, and then the other me, clone me, if you clone me and I have another pharmacy in Hurlingham, which is a private pharmacy, it depends on what I'm making. It's what going to determine how much I'm paying you or how much I can afford. So the market forces, where you get somebody says, okay, if I employ a pharmaceutical technologist, they can accept lower pay. If I employ a pharmacist, then you have this kind of negotiation. Do you want me to be physically present there full time, or how long do I need to work? That determines the pay. So the people who don't have jobs, it's not because we have really exhausted our capacity, to employ pharmacists. I don't think so. I think it's all about all this optimization of profits by investors or businessmen. Or businessmen, I mean, even if I'm a pharmacist, when I open a pharmacy, I'm also looking at the bottom line, something like that. Yeah. because we have people who are migrating, a lot of attrition, people going to other countries. We keep getting requests to validate them, that they are people of, we write letters of good standing and such,
Okay. Now, there's this perception that the pharmacy and the poisons board only shows up when something is wrong. How would you respond to that?
Well, perceptions are built over time, and a lot of it may not be true. Yeah, it depends on how much people know about the organization. I told you that even some of the people we collaborate with in our work, they don't, you can't say that they understand everything about PPB. So for me, I think that perception is based on one thing. That the time they hear, or the public hears of PPB, is when maybe you see some, maybe in the newspaper or in the print media or in the electronic media, that PPB arrested so many people, so many people are taken to court. But what goes on that is not reported is a lot. And I told you PPB, it's about, how do you say? Maybe it's about how people perceive us, not necessarily what we do. It is what they see.
Yes.
So
the disciplinarian part is more.
Yeah, and even for the media, usually such stuff sell more. So I think for us, what we need is to up our game, and to show the other side of what we do, so that people get to understand. Oh, this is what these people do. And sometimes, by the way, we see what people say in social media. Yeah, hatujafunga macho. So we see what people say, and we try to understand why they say that. Then we will see how to correct the image. Yeah.
All right. What is that one habit every pharmacist should have?
Habits. Wow. Me, I think it is the first time I'm being asked to speak about habits. Me, I think every person who is licensed and want to practice as a pharmacist in this country must embrace continual learning and personal improvement. Not just on medication and all that, but even in other aspects, so that we are more.
When I can.
Yeah, you are adaptability. You remain curious throughout your career and try to evolve. Yeah.
Now, since we are now transitioning now, because we're now from the pharmacist, but that is now from a person practicing. Now, facility owners. But before I get into that, what is the best run pharmacy you've ever seen, and what stood out? Yes, that laughter tells a lot.
No, why I'm laughing is because you're asking a question that I would like to avoid.
Why?
Ranking of pharmacists. If you ask me what is ideal, by then I rarely go to pharmacies. That's the interesting thing. Yeah, I used to go to pharmacies when I was an inspector, and that's a long time ago. And this same question, if I may paraphrase it, or put it in another perspective, sometimes even when you inspect a manufacturer and they know you are also inspecting others, they go, how do you compare us to
others?
Which other facility have you visited? Everybody thinks
they are the best.
Yeah?
Yes.
Now, the mistake you don't want to do as a regulator is to do the ranking of the people you regulate. Yeah, we are a regulator. If we had another function, then we would do the ranking. But for us, and I'll give you another perspective to that. You see, like when we assess people for registration, We even give examinations. Those examinations, what is critical to PPB is whether you have passed or not.
Yeah.
So once you hit the pass mark, you are all qualified pharmacists. If somebody gets 99% and you get 50%, you have all passed. That is it. You're not going to say, how many, what did I score? No, we don't do that. But let me put this into perspective of your question again. What PPB as a regulator is doing, we're coming up with standards. And our standards, we have what we call the Good Pharmacy Practice Guidelines, which I hope are going to be approved in the next few months by the board. We have gone through a lot of consultative stakeholder engagements and come up with the draft what would appear or what would be a good pharmacy practice. So the standards are listed there. In this area, this is what you need to do, this is what you need to do. So that is what we'll use to assess. So we have what you call a quality assurance framework. But ranking, nah.
Okay, but then in that same breath, many facilities, of course, will see, regulation as punitive rather than supportive. So how do you personally view the regulator and regulated relationship?
I'm seeing continuously there is a shift. Of course, people who are doing good work, they are more positive. Yeah, they are more positive looking. And the people who, you'll always have people who want to beat the system.
Yes.
There's no time they're going to be positive. Because if I find you, let's say, I'll give you an example. The law says that licenses expire on 31st of December. Today we are on 18th. Then, 31st of December, you are operating without a license. On 1st, you have not renewed. You come to renew in April, or you wait until inspectors come there. Can I ask you something? Who do you blame, the regulator or the person? Yeah. So such a person, do you expect? Okay, they may own up to their mistake, but owning up does not solve the problem. You are operating without a license. Yeah. And if you take regulatory action on them, they'll not be happy with you. I know it is my mistake. Yeah. If you sit in my office, there's a common word which you hear every day when people talk to you. If you point out their mistake, they just say, I'm sorry. But that I'm sorry, does it change the situation that you don't have a license?
Lack some accountability. Okay. But now, talking more of now the gaps, what other common compliance gaps do you see in these facilities?
In the facilities, I think one of the, but it is not about compliance. We are looking at the basics. The basics is about personnel being licensed and all that. But when you go to the details of practice, there are so many other issues which we are trying to handle. There's an emerging issue in what we call antimicrobial resistance. Yeah, nowadays people talk about One Health. So One Health, which means from animals to humans and all that. Yeah. So the use of antibiotics, one of the areas which this country has been called out on is the people who are selling antibiotics over the counter without prescriptions. People who are selling antibiotics to people who do not need them and things like that. Yeah. Then another common one is the possibility of substandard products being found in. This is a reality, it's a global reality, it's a question of what is the percentage. Even in the developed countries, you'll still get such problems emanating. So substandard or falsified product is a big risk that you can find in any market. And then I'm not going to say everything. I think last but not least that I want to mention is what expired product is not worth mentioning because that is very easy to see and they need to be So
I think for most consumers, me being one of them, we check expiry more than anything else.
yeah, but in terms of this is futuristic. We are looking at a situation where we want people to change the design of their pharmacies to be service provision, whatever facilities, so that if I have an issue I must discuss with my pharmacist, there's a private room where we can discuss confidentially. Can take my, you want to take my blood pressure, do for me, maybe blood sugar screening, some of those services which are, we are looking at changing the scope of pharmacy so that pharmacy practice is a primary healthcare. A pharmacy should be a primary healthcare.
Actually, for a fact, I remember I was having this conversation with a friend just not so long ago. The fact that most people will first start with visiting a pharmacy, a pharmacy or a chemist before even heading to the hospital, because just around the area, they'll find that we have more pharmacies than even reaching a clinic or a hospital. And so you first get there, then get to talk to the pharmacist or the one you get there, and you of course describe what you're feeling. Some even self-medicate me, being guilty. I'll start by maybe give me a painkiller, or or I have a sore throat. What can I have? So I feel like it's a great thing for that to be also inclusive, where they can now be able to also offer this basic,
Let me start with an intro. I think I like where you say you talk to the pharmacy or whoever you get there.
Yes.
That is telling. Whoever you get there.
It's true. It happens. Sometimes you're not sure if they are.
No, you are not supposed to ask to speak to the pharmacist. Or if somebody offers to speak to you, you need to ask, so who are you? Yeah, are you the pharmacist?
We get them with Rob, with
no, a dust coat is not.
Then maybe this is a conversation we should be having, because you see, today then I have to know what should a Kenyan at home who is not well versed with, if this is the right person who should serve me, what will be the telltale sign that this is the correct person behind the counter selling me medicine? Yeah.
Well, that's something we are working on, and let me put it this way. By the way, there's something we introduced, a code that you could use to check the status of licensing of a pharmacy, so that if you see that code displayed, we shelved it a bit. We wanted to redo it. Yeah, if you send it to a short code on your mobile, then it will return a message telling you whether that pharmacy is registered or not and who is in charge. Now, one of the legal requirements that the person in charge of the facility, their license should be conspicuously displayed. So you can actually check and you see this is a pharmacy, and the photo appears on the license.
Yes.
And there is a QR code, which you can, of course, that is sometimes not easy to, if it is behind there. Unless you zoom, it's not easy to do that, but they know it is there. It's something you can verify. On our website, anybody can search from anywhere in the world. If you want to search Ochieng, maybe my two names, you don't need to know. You can search by ID, by registration number, which is also usually displayed on the document. You can search, and if the pharmacy is registered or the personnel, you can also search. But now, I like the challenge is something which the board has been considering. Are there any other avenues of confirming who is registered or who is qualified? Currently, if you go to, when we issue licenses, in addition to the license, we issue something which you can actually print and put on a lanyard, and display like a badge. It's a badge. We issue a badge. It has not been made mandatory, but we are considering making that mandatory, that if you are licensed, you must wear a badge, and it is enforceable. But we need to introduce that in regulations.
So I wouldn't lie to you. Why I said that, I have two pharmacies around the area I stay that I go there religiously. If I don't go to the other one, maybe I passed it and I remember there's another one in front of me, I will meet the right pharmacy or the right specialist. But then sometimes I will meet someone else But in most instances, funny enough, I've found a female person. So in my head, I'll just be like, this is the wife. But then I ask myself, is this wife or whoever is here, equally skilled or trained as the right person I've met here? Because I will talk with entirely, I will have like a conversation with them, and I get to like tell that this person is really skilled and is really knowing what he's saying. But then but anyway,
We'll take up that challenge and probably consider what I'm saying. In regulations, we make it mandatory for you to wear your badge, because that is already provided for. It's already in the automatically. If my license is approved now, a badge will be available for me to download. Then we also need to sensitize people and do some campaigns so that people know you are right to ask to see the pharmacist. If it's not a pharmacist in the premises, a farm tech, and also a way of identifying where there's a pharmacist, where there's a farm tech. Yeah, we have proposals which we even discussed with the professional association or society. Yeah.
Okay, so thank you so much. That's it again for this segment. And then you touched on something very important on expanding the scope of pharmacy practice. That is what you're going to discuss next in our coming segments.
Okay.
Yeah, thank you so much.